Please help me change the paradigm of healthcare.
The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I'm the founder of Holistic Caring. We're based here in California, and we do educational programs and case management for patients on how to use cannabis therapeutically as a medicine.
We're also here to decrease stigma around what it means to feel good and be high, hence the H for hope, I for inspiration, G for growth, and H for healing.
As the founder of Holistic Caring, I basically oversee the whole ship, and what we're doing is progressive education.
Cannabis actually supports all 11 organ systems, our immune system, and all the neurotransmitter signaling systems that give messages to tell our body to either do something or not do something. Because the plant was prohibited, it prevented health professionals, doctors and nurses from learning about cannabis as medicine.
I want to change the paradigm of healthcare, and us paving the way into a new vanguard of medicine.
It's about education, it's about empowerment, it's about teaching people how to feel good, bridging the gap from what they're not getting from traditional medicine, utilizing different plant medicines, adaptogens, tips, tricks, hugs, and nugs of information to support and nourish the most important system in our body.
It's a lot of soul work, a lot of love, a lot of discipline, and meditation. I'm using my life work as a testimony to others to learn how they can be their own hero and then go help heal the world.
And we are, as nurses, the game changers.
All right. Welcome, everyone, to the Green Nurse Podcast, Clinical Conversations, where we bring hope and inspiration for growth and healing. Like I had said earlier, we'd like to start off this presentation with just a moment of silence, prayer of protection for those that are facing Hurricane Milton. So we come to you in a time of great need as Hurricane Milton approaches the shores of Florida. We ask for your protection over every soul in its path. May your calming presence be felt by each resident, bringing peace amidst the storm. Grant that the winds slow and the seas cool, diminishing the power of this formidable force. We pray that everyone's needs are met swiftly, that every home stands strong, and that all people and animals remain unharmed. Bless the rescue workers and those that risk their lives to save others. May they be shielded from harm, bolstered by your divine guidance as they carry out their courageous duties. In this moment of vulnerability, may we be reminded of the strength that comes from unity. May us all come together in prayer during our clinical conversations, serving as beacons of hope and healing, working silently to support those in distress with our each unique gifts. Mother Earth in her power holds both fury and grace. May we find protection under her vast skies and learn to live in harmony within her rhythms. May the best version of ourselves come forth in this moment in time as we reach the most people today. I really wanted to start off with that prayer because we have a lot of nurses that are in Florida right now that are dealing with the hurricane. So I wanted to give my heartfelt prayers out to them, and that we are with you in spirit. And we've been doing energy healing work all day long to help, calm those, it's hard to be calm. Hard to be calm when there's so many unknowns. So anyways, just wanted to give that shout out. So back to the Green Nurse Podcast and Clinical Conversations. So Green Nurse Podcast, Clinical Conversations came about when Nurse Elisabeth and I merged our companies, Holistic Caring and the Green Nurse, alongside of Bloom Hemp, creating Holistic Caring Network. Clinical Conversations explores all aspects of how to optimize cannabis as medicine. People are making great medicines. People are selling these amazing formulations, yet no one is truly interpreting how to use cannabis as medicine, and that is what we do. Cannabis nursing, if you all haven't noticed this yet, I talk about this all the time on my podcast, has been recognized as a specialty. And nurses are truly making an impact on advocating for safe therapeutic use of cannabis. Well, what about psychedelics, right? Well, this is definitely a new dawn, and much like cannabis medicine, legitimacy is fought for rather than assumed within the medical model. Clinical trials are underway for the lucky to access these medicines, but there is a vast underground of helpers ready to help those, we call them psychonauts, explore. As nurses, we help others to safely explore their mind and their consciousness using substances for medicinal, healing, and wellness purposes. And Elisabeth and I today are going to be presenting slides. We have a few polls, and then we'll end with Q&A and wrap up with all of our offerings. But I wanted to let you know that this webinar today is being sponsored by Bloom Hemp CBD. And Bloom Hemp is a woman and nurse-owned CBD emporium championing champions of quality, safety, and patient-centered care. Bloom Hemp range features numerous organic CBD products formulated by doctors and nurses to target specific symptoms. Bloom Hemp offers a free nurse line, 970-404-HOPE, and free email care plans with product recommendations and lifestyle tips. So we want to give a big shout out to Bloom Hemp for sponsoring this podcast. Without their support, this wouldn't be possible. Anything else to add, Elisabeth?
That's it. You did good, Sherri. Thank you.
Okay, so now we're going to pull up our slides and get started. And basically, if you all have questions, feel free to pop in the Q&A as we go along. We will take questions at the end. We will open it up. We will allow people to speak, allow people to come on camera if they have anything that they'd like to add or share. But with that, we're going to get started. So therapeutic use of psychedelics with plant medicine helpers. Cannabinoids is plant medicine helpers. And we were really grateful that we were able to present this topic for the Ganjier. We thought it would be important for our viewers to be able to see this as well. And this next slide here, this is the slide that you just saw with Elisabeth and I. We were holding these big giant mushrooms 2 years ago in, was it February? Yeah. February 2022. We were filming High Science. We were part of a documentary. We're still waiting for it to be launched. We were in Jamaica actually filming. And this slide here, Elisabeth and I had the opportunity to actually visit a mushroom grow house, which was very, very interesting. Yeah, you want to talk a little bit about your experience?
Well, I just couldn't believe that there were all of these rows and rows of bags of mushrooms, and this is how you harvest it. You just literally just slice a piece off of what's protruding out of the bag, and there you go.
There you go. And that's called a mushroom truffle because it is the raw form of mushroom, very much like cannabis. You know, it goes through a curing and drying process, but there's a lot of different ways to consume it. We wanted to just kind of give you a little bit of, I call it eye candy on what we've actually been doing in the field. We've been doing psychedelics as medicine for a while now.
Yeah. And it was really fascinating to see this. So a quick disclaimer, all content provided by Holistic Caring and the Green Nurse is for general informational purposes only. This information provided is not to be a substitute for professional medical advice, diagnosis, or treatment. These statements have not been evaluated by the FDA or any other official agency. Psychedelics are still illegal, and we do not encourage or condone the use of psychedelic substances where it is against the law. However, we accept that illegal drug use does occur and believe offering responsible harm reduction information is imperative to keeping people safe. The essence of nursing is human caring for the entire human experience without judgment. Holistic Caring and the Green Nurse is not responsible or liable for any information, services, or products that you obtain as a result from this presentation or program. May you find peace and joy in your exploration with us. And we are educators. We're not selling these medicines, and so we're just educating because we know that people are finding them, and it is important for us to have your back.
So just a little bit of background about me. I've been a nurse for a very long time, since 1988, 25 years in the conventional system in the Boston teaching hospitals. including critical care, oncology, pediatrics, hospice, home care, home infusion, and telehealth. I've had 20 years in holistic nursing, working with nutraceuticals, energy healing, and other progressive modalities that support and nourish the endocannabinoid system, and 10 years in the plant medicine arena, actually working with cannabis and psychedelics. I'm grateful to be the Chief Nursing Officer of Holistic Caring and the Green Nurse, and Holistic Caring Inc., which is our nonprofit, and also Chief Nursing Officer of Bloom Hemp. I'm also the founder and host of the Green Nurse award-winning podcast, founding member of Cannabis Nurses Network, and the International Association of Psychedelic Nurses. I'm currently sit on the board of directors of the American Cannabis Nurses Association, and I am a contributing author of Clark's Cannabis, a handbook for nurses.
And I'm equally as busy, a nurse for 1 year longer. Finished my MBA in healthcare administration back in 1996 and only spent 8-9 years in hospitals, and then spent the next 19 in insurance carrier operations and sales, and then 10 years in plant medicine, working with cannabis and psychedelics. I'm the CEO of Holistic Caring and the Green Nurse and Holistic Caring Inc. and Bloom Hemp CBD. So we do stay very busy. I am the past treasurer of the American Cannabis Nursing Association, serving on their board, and I serve on the board of Los Angeles Normal as the director of health, as well as the Coachella Valley Cannabis Alliance Network. Here, we just call them CBCAN. And also a co-host of the Green Nurse podcast and Clinical Conversations. And then this is my book, Cannabis for Health, Become a Coach, which really kind of started everything for me.
There we go. Okay, so we're going to start with a couple of polls, everyone. So I'm going to pull up the first poll. Have you ever microdosed psychedelics? Feel free to answer. If you don't want to answer, that's fine. This is just going to kind of let us know where people are on the platform. You know, there's a spectrum of people, of experimenters. You know, some people may have experimented in high school and college. Some people may have done psychedelics as a therapy. Some people may have gone to raves. There's a lot of different things. Some people might be exploring microdosing. So have you ever? Okay, so 57% said that they have microdosed. And yep, okay, so publish results. It'll publish that result.
Yeah.
Okay, and then I'm going to go back to the next one. The next question is, have you ever taken a deep dive, meaning taken a journey using psychedelics, using more than sub-perceptual doses? So when we're talking about microdosing, you're taking a dose that is not causing a hallucinogenic feeling. But a deep dive is when you actually do have the more hallucinogenic experiences. And so we just want to know those people that may have experienced that. And then I will publish. Okay, so we about 50-50. Okay, there we go. 50-50. So that's good. That's really good.
Okay.
And then the next one is, have you ever used cannabinoids as plant medicine helpers for either microdosing or macrodosing? In other words, have you used cannabis, CBD, and THC while you were microdosing, or have you used cannabis, CBD, or THC when you're taking a deep dive? Yes or no? And we can see those results. And we have, good, that's pretty good. 60 cents, I'll publish those results. 66% says they have used cannabinoids as plant medicine helpers, and 33% has said no.
Yeah, about the same numbers. So there's, yeah, that's good. And that's actually fairly normal for this day and age, the end of 2024, with all of these plant medicines available. And, we're not going to say exactly, but, in the Northeast, Boston area, Oakland, Denver, there are centers across the country where it's legal to have both cannabis and psychedelics. So these numbers are going to continue to come up. So, okay. Well, that's great. Let's just move ahead.
Move right ahead with learning objectives. So learning objectives, the learner will understand the intersection of cannabis and psychedelics. We're going to talk about that in upcoming slides. Understand the therapeutic use of psychedelics. Understand an overview of conditions treated with psychedelics as medicine. Understand the basics of various psychedelics and their mechanisms of action. Understand the appropriate use of cannabinoids and product choices when using psychedelics. and understand activities to nourish and support the endocannabinoid system and endocannabinoid dome to promote relaxation and healing. So the interesting thing when we're talking about psychedelics as medicine is, you have these rich, deep experiences, but the most important thing is how are you integrating them into your life? And this is where we come in as cannabis nurses to teach on the endocannabinoid system and the endocannabinoid dome to nourish that system as you are exploring.
And one of our favorite phrases is, I come back different, but the world hasn't changed.
Yeah.
And that's what we're here to help you figure out. So this is a study done this year from New Frontier Data on cannabis and psychedelics. And they were looking at, should psychedelics be legalized? And have you ever used LSD, psilocybin, MDMA, or ketamine? Half of the consumers in the survey support access to substances like LSD, psilocybin, MDMA, and ketamine for therapeutic use, while 21% do not, and 28% are still deciding. This progressive stance is particularly intriguing given that 60% of these respondents have never tried these substances themselves. So they want for others what they don't even have for themselves because we recognize the therapeutic potential.
There we go. So therapeutic use of psychedelics is the use of entheogens for medicinal, wellness, and healing purposes, particularly for mental, physical, and spiritual health. An entheogen is a psychoactive substance that induces alterations in perception, mood, consciousness, cognition, or behavior for the purposes of engendering spiritual development and sacred texts. So using psychedelics is personal and subjective to each consumer, with objective criteria being improvement within one of the 5 health domains: biological, mental, emotional, spiritual, and social, without negatively impacting any of the other domains. So just like we had said before, psychedelics is a new dawn, and much like cannabis medicine, legitimacy is fought for rather than assumed within the medical model. Clinical trials are underway for the lucky to access these medicines. Again, there is a vast underground ready to help regular psychonauts explore, and as nurses, we help others to be safe as they explore their mind and consciousness using these substances for medicinal healing and wellness purposes. And this is just an image of me jumping out of a plane. I was not high, I was not tripping, I was not on any substances, but it was my celebratory jump of coming off of 18 pharmaceuticals. Cannabis saved my life, and psychedelics were facilitators to help me to heal from PTSD trauma. Again, my celebratory jump, weaning off of 18 pharmaceuticals using multiple plant medicines.
The green nurse right there.
Right there in my hand.
Okay, so psychedelic medicines show benefits for several different domains. So mental health, depression, anxiety, suicidal ideation, addiction, alcoholism, PTSD, OCD, panic disorders, agoraphobia. And on the physical health, chronic pain, phantom limb pain, smoking cessation, eating disorders, Lyme disease, Alzheimer's disease, and dementia. Interesting. Migraines, cancer and its effects and side effects. And spiritual health, healing trauma, personal growth and emotional development, coping with terminal illness, fear of impending death, and existential crisis. It's that biopsychosocial spiritual healing so that you can live your best life.
Okay, mechanism of action for psychedelics. So we have the classic psychedelics, psilocybin, LSD, DMT, they all affect the brain differently. They're direct agonists of the serotonin 5-HT2A receptor that causes the psychedelic effect. So direct agonism of 5-HT2A is what knits together the brain connectivity, weaving in imagery and hallucinations, visions, messages, and information from the unconscious. And basically, is the trip necessary to heal the psyche? Well, many wonder if there are non-psychedelic 5-HT2A agonists. Are there drugs that nudge the brain this way without hallucinations and dissociation? Well, according to Dr. Robin Carhart-Harris, he's a UK neuroscientist that's been studying this for years, tripping may be what you need to get your ego out of the way to grow. We can't have an egoectomy because it's part of who we are as people and it's there to protect us. but oftentimes the ego can get away of us being open to new information for change. So SSRIs in general work by softening feelings of despair, blunting emotions so we can tolerate more stress, but tolerating stress isn't healthy, right? Our experience suggests is to start with microdosing first. So the classic serotonergic psychedelics like LSD and psilocybin creates entropy within the brain, firing throughout various networks, allowing the brain to build new neural pathways that allows us to be able to be open to change.
Connect the dots.
Connect the dots.
The ego doesn't want change, but that is what we need. So this grid is a comparison of the psychedelic drugs that we might see in circulation today. And you see the drug, the onset of duration, so when it starts to hit the body, and then duration, how long that experience lasts, the mechanism of action, and then the effects. So we can see with LSD, it's 20 to 60 minutes onset, and this really has to do with your metabolism as well as what's in the stomach. And all of these should be taken with a good 3-hour fast before you do any of it. Duration of LSD is the longest, 10 to 12 hours, and it is a direct agonist of the 5-HT2A receptors, the serotonin receptors in the brain. The effects are mystical, visuals, egoless, expansive, euphoric, creative thoughts, and that expansiveness is, you can't undermine how that feels for people, these explorers that have tried LSD. Psilocybin, a little bit of a longer onset for some people, otherwise about 20 minutes on an empty stomach. 4 to 6 hours is the average journey, 5-HT2A. And again, the experience is mystical with visuals, egoless, expansive thoughts. MDMA, 20 to 60 minutes, but this is a little different, 4 to 6 hours in the duration. And it really hits the 5-HT1A and 1B receptors in the brain, which are different than the 2A receptors. So it's not a classic serotonergic psychedelic. It's a little different. It also floods the brain with neurotransmitters, activating just about every one that you have in the body. And it can be a little stimulating, and MDMA as partial amphetamine as well. So the effects are euphoria, arousal, empathy, relaxed. And this is the drug that MAPS is trying to get through clinical trials by the FDA to get this approved as a substance for PTSD and counseling with some of these veterans. Ketamine, as we know, it's an anesthetic, but it also can be given as a rapid-acting antidepressant, breaking suicidality very quickly. It's given IV, IM, intramuscular, a shot, troche lozenges. Duration is very brief, an hour to 2, depending on the route. And it really is affecting the lateral habenula in the brain, along with some of the neurotransmitters, and it stimulates BDNF, so the brain-derived neurotrophic factor, which helps also with neuroplasticity, new learning, and that sort of thing, to really have a therapist then engage with that person and explore how they're going to work around some of the problems in life. It can be very dissociative, dreamlike, and mystical. DMT is another serotonergic, and it's generally inhaled or snorted. So it's very, very rapid acting. Within a minute, you feel the effects of that drug. It can last 30 to 45 minutes, so it's the shortest acting. And as I was doing the research for the program, I found it was interesting that it's called the businessman's trip because it can be done at lunch. Anyway, so 5-HT1A and 2A receptors are both affected. And again, it's a mystical experience with visuals, the egoless feeling, and expansiveness. And ayahuasca is the old friend, the old mother, grandmother. Onset in 30 to 60 minutes, 6 to 8 hour duration. And ayahuasca is generally done in tribal settings down in South America, where it was pioneered, and very much a ceremonial format with a ritual. And there's a diet, a cleansing diet to take as well, because it's an MAO inhibitor. And so you don't want salamis or aged cheeses or alcohol or things like that. You got to eat very clean before that. But again, it's a mystical experience with visuals, that egoless, that ego death, and then expansiveness in the thought.
And so before she goes ahead, so these comparison grid of psychedelic rubs showing the drug, onset, duration, mechanism of action and effects, this is for deep dives in particular. This is not a microdosing chart. This is a chart for people that are taking more of the deeper dive, actually having a ceremonial experience and having a longer duration of an experience. So microdosing, we generally see people mostly using LSD and psilocybin.
Yeah, and that goes back to this tripping. According to Robin Carhart Harris, tripping is what's needed to get your ego out of the way. So all of these would result in an ego death of some kind, except really for MDMA and ketamine. So,
but I don't know about you, Elizabeth, but has your ego truly died?
No, it's temporary. It's very temporary, right? It's only for the duration, and really it's only in the thick of it. We're like LSD, psilocybin. We're talking like 2 hours in. It's going to got rid of it. But it comes back as it's starting to wane.
Right, because we can't have an egoectomy, truly. It's there for a reason. So psychedelics and cannabinoids. So we're in the midst of a psychedelic revival where there is more interest than ever before in experimenting with cannabis, psilocybin, LSD, ayahuasca, ketamine, and these other substances. So cannabis and psychedelics such as psilocybin, ayahuasca, peyote, iboga were revered as plant teachers by native cultures. Cannabinoids were often used together with these other plant medicines via inhalation in ancient ceremonies to mitigate side effects and enhance the healing experience. In the 60s, psychedelics and cannabis were linked as part of the counterculture. Many who took LSD also smoked cannabis, and 60 radicals celebrated LSD as a chemical capable of undermining the established order, celebrating individuality and the alternative lifestyles. So here's some quotes for some consumers and some patients that we've taken care of. LSD helped me heal my consciousness, and cannabis kept me off of pharmaceuticals and out of the hospital. This was a 75-year-old nurse. Another retired business executive quoted, "If it weren't for LSD, I would still be a Republican, and cannabis helps me with the pain." So again, this is personal and subjective to each consumer. Again, high doses of THC are hallucinogenic, and microdosing LSD is a lot like CBD. And this is a quote from Martin A. Lee, who's the co-founder and director of Project CBD, who actually wrote a book called Smoke Signals.
He's a good man. I've met him several times. So is cannabis psychedelic? Yes and no. It depends on who you ask, and of course, dosing, like always. Scientifically, psychedelics are drugs that activate the 5-HT2A receptors. Cannabis, on the other hand, activates CB1 and CB2 receptors and indirectly affects the serotonin receptors. So is cannabis psychedelic? Yes. High doses of THC can cause paranoia, hallucinations, and psychosis. Ask any person who has greened out, and they will tell you how awful it is. It's, again, very transient. The psychosis is never permanent. And then, no, low doses, to put emphasis on that, THC, CBD, and other cannabinoids do not induce hallucinations or psychosis. It is rare for a recreational consumer to have a psychedelic effect unless purposefully over-consuming high THC products or mixing edibles and dabs. Cannabis psychedelic journeying is a practice where a guide can lead a client on a guided meditation after a ceremony of frequent inhalations of mixed cannabis flowers. Intentions and affirmations are set with each inhale prior to closing the eyes and being led on a sacred journey with music. This practice can be customized to each person. Intuitive inhalation is taught where a person meditates and asks spirit how many inhalations should be taken and for what reasons. Afterwards, the experiences are shared, if done in a group, for integration and ongoing healing to seek clarity and consciousness. And if anybody wants to follow Alex Gray, the visual art of psychedelics is expressed like no other human on earth is doing. So they're just beautiful pieces of work.
Mm-hmm. Okay, psychedelics and cannabinoids. So cannabis can help many cannabis. Many people use cannabis in combination with psychedelics. We always encourage people to be very cautious. So moderate doses of THC can help mitigate side effects of nausea. Higher doses of CBD can mitigate side effects of anxiety. Higher doses of THC to intensify the trip. THC actually primes the 5-HT2A receptor. Moderate doses of CBD and THC to lessen the come down effects and to promote sleep. So cannabis and psychedelics can slow down time and intensify the present moment. The difference has to do with setting, substance or substances being used, sitter, the people that you're with, the session, and the situation, which is different for everyone. Psychedelic trips release explorers from day-to-day consciousness so vividly that a few puffs of cannabis seems tame in comparison. So inhaling a cannabis joint is much shorter acting than taking a heroic 5-gram lemon tech psilocybin trip. Trust me on that. So ketamine, psilocybin, and LSD are compounds that promote neuroplasticity and new neural connections in the brain. The antidepressant effects of psychedelic drugs is contingent upon neurogenesis, which is brain cell growth. So cannabis also spurs the creation of new brain cells, unlike alcohol exposure, which disrupts adult neurogenesis in animal models. THC can increase neurogenesis by activating CB1 receptors in the hippocampus, the locus of short-term and long-term and spatial memory. And CBD, again, reduces anxiety and depression by stimulating neurogenesis in the hippocampus. Anything to add?
No, they all work together very nicely, but it all comes to intent. And these 6 S's are explored in depth in our programs, and
We'll go over that.
we'll go over those at the end. So psychedelics and cannabinoids. To continue, CBD is the most abundant non-impairing cannabinoid that activates over 70 targets in the body. CBD activates several of the serotonin receptors. CBD is a partial antagonist at the 5-HT2A receptor, and this can partially block or reduce the intensity of the psychedelic at that receptor. CBD is an allosteric modulator of the CB1 receptor, dialing down psychoactivity of THC within brain regions. THC dampens short-term memory when given with psychedelics because CB1 and serotonin receptors form CB1 5-HT2A heterodimers, or little junctions where they literally pair up and can get activated as a clump as opposed to 2 individual receptors, which are active in the brain areas involved in memory impairment or the hippocampus. THC in high doses mixed with psychedelics could have additive or synergistic effects, while CBD may soften the psychedelic effects. Many use a combination of various cannabinoids and psychedelics to break other drug addictions. This is very interesting. We know CBD has anti-addictive properties and may boost recovery rates as part of an overall harm reduction plan. And now we're learning that psychedelics also help people stop drinking, smoking, and using street drugs.
Here we go. So psychedelics and cannabinoids. So concurrent administration of high THC cannabis and psychedelics may have an additive or synergistic effect when it comes to visual hallucinations. This effect is subjective, and everyone has a different threshold and tolerance. So for example, a 2013 research paper found that THC, a cannabinoid receptor agonist, can upregulate the 5-HT2A serotonergic receptor, increasing their biological responses to stimuli. This may increase the potential for psychedelic visuals. So in other words, if you really want to have visuals, then you don't want to be using a lot of CBD. If you want to have more intense visuals, then you want to increase your THC. So dysregulation of 5-HT2A is also linked to a variety of conditions such as headaches, anxiety, depression, psychosis, and schizophrenia. So we must be very careful. A 2018 research study found that chronic exposure to THC induced a pro-hallucinogenic formation of the 5-HT2A receptor in mice, which exacerbated schizophrenia-like responses. We're not saying that this is going to happen, but we need to talk about these things because they're important. CBD is currently being evaluated for its antipsychotic effects. So taking CBD with psychedelics may reduce their psychomimetic, this is what we call the hallucinations or paranoid delusions effects, but this relationship also remains unclear. In our experience, we have seen CBD benefit explorers before, during, and after. and even microdosing.
And this just reminds me, chronic exposure to THC causing psychosis and schizophrenia-like responses, CBD ameliorating those, known for the antipsychotic effects and actually removing any kind of those paranoid delusions. So, this again is the emphasis. Cannabis is not one thing.
Yes.
The plant is multifaceted. There are hundreds and hundreds of different compounds, with at least 150 of them being cannabinoids. So, psychedelics and cannabinoids, cannabis can have a profoundly distinct impact when taken concurrently with psilocybin. In the 2019 Pro Psychedelic publication, Double Blind, they surveyed 90 people who combined cannabis and psychedelics. Dr. Nikola Jordvek, a medical advisor at Loud Cloud Health, confirmed that many people's senses are enhanced when they combine cannabis with psilocybin. And this may manifest in the person experiencing intense audio and visual hallucinations. The strong visuals produced by cannabis in conjunction with psilocybin may be exciting for some and terrifying for others. The antiemetic properties of cannabis in some products, CBD products with botanicals, may mitigate nausea that can occur with mushrooms or other psychedelics. So for people combining cannabis and psilocybin, it can be a way to enhance and prolong the experience. And so enhance and tap down, right? So THC enhances, CBD taps down, and a good tincture might help some of that nausea.
There we go. Psychedelics and cannabinoids. Anecdotal reports suggest that LSD and psilocybin may help with pain management. So scientists are testing such psychedelics on various types of pain conditions, cluster headaches, chronic pain, fibromyalgia, and even phantom limb pain. There is compelling preclinical evidence that psychedelics work via psychological mechanisms within the brain, but also have direct effects on descending pain pathways. Cannabinoids work on several pain pathways to lessen nociceptive signaling and inflammatory pain. So targeting psychedelics for pain would not be the first time that a drug was developed for one kind of treatment, but is being co-opted for something else. For example, gabapentin and pregabalin, which is Lyrica, are anti-seizure drugs that are now being prescribed for nerve pain, whereas Cymbalta is an antidepressant often used to address chronic mucoskeletal pain. So microdosing LSD and psilocybin with low-dose cannabinoid combinations may actually help to ease pain, and we've seen that now. Yes.
Yeah, and many people come to psychedelics to break addictions. Adding CBD to the treatment plan provides another tool in the toolkit to accelerate healing from addictions. CBD and psychedelics can be a harm reduction tool for therapists. CBD has reduced anxiety via the 5-HT1A, not 2A, 1A, just our regular serotonin receptors in animal studies of fearful memory reprocessing and their learned fears from PTSD, which can fuel addictions. CBD also reduced fear memory reconsolidation and enhanced fear extinction, both resulting in lasting reductions of fear and greater senses of calm in the patients. And CBD may lessen addiction by reducing the expression of drug memories and by disrupting their reconsolidation. The anxiolytic effects of CBD may regulate this emotional memory processing, eventually leading to its use as a treatment for anxiety-related substance disorders. So we're still in the research phases here, but one of the things, and I kind of tripped up in talking about the regular serotonin. Normally we're talking 1A. And that is what the cannabinoids really influence the most, and CBD is very prevalent. The 2A receptors are a very specialized receptor that hardly ever get nudged in our normal life. If you don't do psychedelic drugs, the 2A is basically untouched from 0 to 80 for most of us.
So reach out and touch your 5-H2A receptors. Right? Yeah, we got to give them also a little love there. So CBD and psychedelics may potentiate neurogenesis. How cool is that? So data indicates that cannabinoid ligands, these are the keys that control cell genesis signals in the adult brain by activating CB1 and CB2, the locks, regulating cell proliferation and overall neurogenesis in the mammalian brain. So psychedelic activation of 5-H2A can boost neuroplastic changes. Again, we're not seeing these being hit by anything else. So new connectivity between our brain regions, synergies between cannabinoids and psychedelics hold great promise in reshaping the brain and learning new behaviors. So both cannabinoids and psychedelics offer an opportunity to help create new neurons, key to growing a healthy brain. Right? That's what we want. Healthy brain.
And so CBD can really affect depression in a very good way. So CBD and psychedelics used together may potentiate the antidepressant effects of each other, and helps many also stop using pharmaceutical antidepressants. And it's a careful walk down this pathway for those who are taking conventional antidepressants. We don't want to have our body filled with SSRIs or tricyclic depressants, and then throw in some psychedelics, because you could get serotonin syndrome, which is a medical emergency. So taking CBD with psychedelics for depression is synergistic. Both activate the serotonin receptors, which is key to making and retaining serotonin, our feel-good neurotransmitter. CBD also works on dopamine receptors, our motivational neurotransmitter, influencing the reward system, and may be synergistic in developing new learning pathways. And a stronger sense of calm, agency, and self, with a capital S, our higher self, may emerge with a focused, intentional approach to combining CBD and psychedelics. When ingested, CBD activates serotonin and dopamine, and you can see some of these receptors right here, and they just nudge and fit right in there in that lock and key type of fashion.
Okay, self-love and self-care. Psychedelics are not the answer to your problems. You are. Self-love and self-care. There was no one more important than you. How do we all stay well in our body, mind, body, and spirit? By having the tools that we need to get into the relaxation response so we can process emotion, integrating what we learn in our day-to-day experiences as the deep aha moments settle into the psyche. So CBD and cannabinoids are best tools in the kit to promote lifestyle as medicine, to live an energized life. Whole plant CBD formulations are the base, with THC usage in small doses as needed. Microdosing psychedelics is to be done with set intentions, goals, and a plan to maximize benefits and minimize harms. Deeper dives are for those who are ready to explore their minds and their consciousness for healing, and to do the interpersonal work needed for lasting change. We don't encourage people to do these without really thinking it through, because you can't undo once you do it.
Right. Yeah. Once the medicine is in, you're going for a ride. Don't forget to love yourself, and say every day, I love me. In fact, I challenge you, look into a mirror every day and tell yourself how much you love yourself. It really does make a difference. So hope, inspiration, growth, and healing. This is something that Nurse Sherri coined as her high. What do you call those things?
My high
Starts with an A, an acronym.
Yeah.
Yeah. We all deserve to feel good. Plant medicines and psychedelics are tools for biopsychosocial spiritual healing. Cannabis is a tool that brings hope and inspiration for growth and healing at all levels. Hope is the first thing that plant medicines bring to people. It opens the door to imagining healing as possible. Being inspired with inspiration is being in spirit. This opens the door to opens you to new ways of healing and to doing what you are called to do. Growth is an action word that comes from being inspired to do something differently and taking action steps to make changes, growing in health. And healing is doing the best you can with what you have right here and right now. Health exists on a spectrum and needs to be defined and measured by each one of us. And most drivers of health sit outside the conventional healthcare systems and are modifiable by us. And what I mean by that is it's not just the pills and the procedures that are going to fix us. That's how we've been conditioned, but that's not at all true. This is true.
This is true. Health is mostly about function, not disease or death. Health is the physical and mental energy, whether we can fully use our senses, and the extent in which we can comfortably engage in meaningful activities to live our best lives. Health is our strength, our memories, our ability to solve problems. It's our ability to cope with the challenges of life, our ability to build and sustain intimacy, and our sense of agency, positivity, and purpose. Strong health helps us to lead meaningful, productive, and satisfying lives. Healing isn't the absence of illness or disease, but it's living your best life and doing your best at any given moment. Cannabis and psychedelics are tools for optimizing health functioning and expanding our consciousness for healing.
And by the way, this is from McKinsey, the big consulting house. I love reading all of their work, and they have quite a bit on health and progressive nature of what healthcare is becoming. So if anybody wants to check out more of the studies, check out the McKinsey Institute. So are psychedelics for everyone? No. Psychedelic experiences are not for everyone. And to avoid doing harm to both the participant and the guide, skillful screening based on good information is critically important. The following factors and exclusion criteria should be considered in the screening process, in particular for those who want to take a deep dive. So we're not talking a microdose and just a little bit here and there, but this is the big trip. So age, the participant should be of legal age and consent. However, there's not necessarily a timeout. There are some end-of-life cancer patients at Johns Hopkins in some of the studies that are in their late 70s, and they do okay if they're otherwise healthy. Stability, a stable life with housing and a safe space to reflect on one's own internal processes is necessary. If female, they should not be pregnant or breastfeeding. Disabling medical conditions, so no unstable cardiovascular disease and or severe hypertension, because these drugs can spike heart rate and blood pressure. Disabling unstable or acute mental illness or addictions, so no active alcohol or drug withdrawal. No active unmanaged psychiatric disorders such as bipolar disorder, schizophrenia, psychosis, and personality disorders, as these individuals are at a higher risk of prolonged destabilization. And destabilization is, think about the airline pilot that got, almost crashed a plane a day after using high doses of psychedelics. He probably had something inherently going on with him before he did those that really tripped that off. And so you don't want to have any kind of personality disorders. That's a big one. No anger management problems, history of violence to self or others, especially for people doing this in group, or somebody that can become destabilized. No current suicidal or homicidal ideation. No active unmanaged neurological disorders such as stroke, dysautonomia, epilepsy, serious brain injury, to minimize the risk of adverse effects such as having a seizure. Current use of tricyclic antidepressants, and I have this starred because it can be dangerous. SSRIs, most of the standard antidepressants, MAO inhibitors, St. John's wort even, should be avoided due to the risk of serotonin syndrome. And the MAPS people, Buckley Institute, Johns Hopkins, all of them have drug washout protocols. So those who have refractory conditions that are taking antidepressants have a fast withdrawal over about 2 weeks, and then they can go into the trials. No individuals on mood stabilizers, lithium, valproic acid, antipsychotic medications like Haldol and Risperdal, which imply a diagnosis of serious mental illness. And then no unwillingness to self-reflect or take responsibility for our actions or do the work. That is a red flag. Somebody's got to say, I want to change. I'm open to change. How do I get there? And that is the people we want. So this is kind of the checklist that as clinicians, we are able to disseminate to you to help guide others.
There we go. Who can we help with psychedelics? Well, here are groups of individuals with whom psychedelics might be considered. Individuals with treatment-resistant mental health conditions. Research indicates that psychedelics may offer promising treatment options for individuals facing treatment-resistant depression, anxiety, PTSD, and mental health issues when traditional therapies have proven ineffective. Individuals pursuing personal growth and self-discovery. For centuries, psychedelics have played a significant role in spiritual and self-exploration practices. Those that are seeking insights, personal development, or a deeper understanding of themselves find psychedelics to be a valuable tool. Addressing end-of-life distress. Psilocybin has the potential to alleviate existential distress and enhance quality of life for individuals confronting life-threatening illnesses, palliative care environments, and doing legacy work. individuals seeking transpersonal or spiritual experiences. Psychedelics have long been employed in numerous spiritual and shamanic traditions to induce altered states of consciousness and to promote transcendent experiences. So we've got a picture of Coach Michael there. He's amazing.
Love Coach Michael.
Love Coach Michael.
So, and it is, education and integration, and that's what we do. So many of the clients that come to us, whether it's for cannabis or psychedelics, are in crisis. They're feeling that they can't survive this. They're struggling. They're barely surviving, and they want to be thriving. And many of them are doing the things on this list already, right? Food is medicine, is adaptogens, exercise, motion is the lotion. We all know that. Meditation, prayer, breath work, mind-body medicine, vagus nerve stimulation, massage, therapeutic touch, acupuncture, chiropractic care, essential oils, aromatherapy, energy healing, Reiki, reconnective healing, sound healing, chanting, music, drumming, eliminating alcohol and quitting smoking, restorative sleep and rest, enhanced social connections, laughter and play. Always laughter is the best medicine. Journaling, writing, and then cannabis and hemp products. And often what happens is they've tried all of these things, and then once we introduce cannabis and some good CBD, everything else starts working. And then they need less and less of the cannabis and hemp supplements because the other things that they're doing are working. And some are happy to stay on the good CBD because they're not spending so much money on all of the other kinds of modalities. But when you are in crisis and struggling, you'll spend anything to get to feel good. And managing the stress response, and we talk often about this relaxation response. This is where the body heals. And when we modulate the endocannabinoid system and the endocannabinoid dome, that's how we get ourselves into the healing trajectory.
So I'll just add, the endocannabinoid system signals both the fight or flight response and the relaxation response. The fight or flight response we cannot control. I don't know how many people have been in the fight or flight response. I know we all have at some point in time in our lives, right? You can't control it, right? But getting into the relaxation response is something that we can control, and it requires mindfulness, conscious awareness, and practice. Doing these different things and including cannabinoids can be facilitators to help you to be able to explore some of these other tools in the toolbox in case you don't have cannabinoids, right? So really powerful stuff. Okay, so mental wellness bundle for Psychedelic Explorer. So optimize the endocannabinoid system for mind, body, spirit wellness with comprehensive protocols spanning 4 to 8 weeks. These products harmonize digestion, energy, relaxation, guiding your inner equilibrium to start thriving. Oftentimes people will come to us that are new and want to explore psychedelics for microdosing or even take a deeper dive, and they haven't even explored cannabinoids yet. So one of the things that we like to do is wake up their endocannabinoid system first. And some of the things that we like to do that with are some products. So for example, the Bloom Hemp Digestive Tincture has CBD, CBG, fennel, cumin, and coriander. And the reason why this is important, I want you all to think, did you know that we make the most serotonin in our gut? We make serotonin in our brain, but we also make it in our gut. We make the most of it in our gut. So improving gut health is really, really important. Essential Calming Tincture. This is full spectrum CBD with CBN, lemon balm, lavender, hops, and California poppy. Amazing tool to help promote the relaxation response, help people decrease anxiety, decrease inflammation, and promote sleep. So this is aimed to alleviate anxiety, foster sound sleep, and nourish the endocannabinoid system. Then we have Bloom Hemp Energy Gummies. It's just got 25 milligrams of CBD infused with caffeine, a quarter cup of caffeine, 20 milligrams, B vitamins. This is ideal for a coffee alternative. This is good for people that are exploring psychedelics the next day. Oftentimes they might be fatigued, right? You think about if you're doing a deep dive with psychedelics in particular, all of your neurotransmitters are being flooded. And so the goal is to get back into balance. And CBD products and cannabinoids can be facilitators of that. Bloom Hemp CBD gummies, sleep gummies have 25 milligrams of CBD with 3 milligrams of melatonin, passion flower, and L-theanine to help promote the relaxation response and for deep restorative sleep, improving REM and improving restorative sleep. And then again, full spectrum CBD capsules packed with 25 milligrams of full organic CBD as a supplement for overall health, wellness, and well-being. So oftentimes when people are new to this is something that we might recommend for them to get started on for 4 to 8 weeks, and then they may start to experiment and microdose with their psilocybin or LSD, whatever substance that they decided to choose.
And really, this is part of the education, not really sales, because you need the underpinnings to be healthy before considering some of the psychedelics, and especially somebody that wants to do a deep dive. You gotta, it's like taking the car in to get tuned and serviced before you go on a big road trip.
Yes, that's exactly right.
So what is the future of psychedelic and ECS-based therapies? Well, the exploration of ayahuasca, MDMA, ketamine, LSD, and psilocybin in clinical research highlights the evolving understanding of these substances' therapeutic potential. Their interactions of the ECS represent an exciting frontier in neuropsychiatric treatment, offering new avenues for managing mood disorders, addiction, PTSD, and chronic pain. As research progresses, integrating these compounds into clinical practice requires careful consideration of their risks and their benefits, along with the ethical and regulatory frameworks to ensure safe and effective use. In summary, the therapeutic potential of these plant medicines and psychedelic compounds, particularly in conjunction with ECS endocannabinoid system modulation, presents a promising future for treating a wide range of mental health conditions. With continued research and a thoughtful approach to their clinical application, these substances could revolutionize the field of medicine, providing new hope for patients worldwide. So mind, body, spirit, biopsychosocial, physical, it's all of the above. And we can't get there soon enough, because medicine is fundamentally flawed and failing. And these plant medicines have always been with us, and they're going to come with us in the future.
Okay, so we have another poll before we wrap up. Would you like to use cannabinoids for medicinal, wellness, or healing purposes? So would you like to? If you're already using them, answer yes. If you're already using them, answer yes.
Yeah.
Okay, there we go. We got 6.
Good, 100%.
Publish. All right.
We have
one last question. Would you like to try psychedelics for medicinal, wellness, or healing purposes? So if you haven't, you can, if you've already done it, you can click yes. And if you haven't tried it, are you interested? There we go.
Yeah. If you're not at all interested, click no.
Yeah. If you're not at all interested, you can click no for sure. No, we got 100%. Yep. Yes. Ooh, we got 1 no. Okay. Good. Here we go.
Yeah.
Publish results. That's all good.
And because not everybody is up for this, and that is about what most Americans poll at. Interestingly.
Yeah, and I had something that I had written that I wanted to read a little bit, and it basically had a lot to do with integration in particular. While the experience of taking psychedelics can be profound, so too can be the process of understanding the experience after it has happened. Psychedelic integration is a process of making meaning of a psychedelic experience and translating that insight into positive changes in daily life. Integration activities can apply to any psychedelic experience, including therapeutic, recreational, or spiritual use. Over the years, the concept of integration has come to include a wide array of activities and approaches that reflect different cultural traditions, psychological tools, physical activities, social organizing, as well as connecting to traditional and indigenous wisdom of the use of these sacred plant medicines. However, much research is being conducted on the medicalized model care for post-journey integration, psychotherapy. And when it comes to understanding the process and impact of psychedelic integration, there is a need to deepen our understanding of the ways that most people use psychedelics and integrate their psychedelic experiences with their peers and in the community. In general, I wanted to bring that up.
And okay, well, thank you. It's about education and integration. It's about healthcare. It's not recreation. A lot of people will use cannabis and psychedelics as recreation, but this is about health. Cannabis, psychedelics is about health in the way that we approach it. And when we know it's not for everybody, there are things that you can do without the medicines, right?
Yes.
We wake up our endocannabinoid system with cardiovascular exercise, chocolate, connecting with other people, very much how we stimulate good serotonin. Just good, healthy living, diet, having echinacea, that sort of thing. And psychedelics, just savoring life can really help as well.
Yeah, and it can help you to slow down. So conclusion and invitation, psychedelics and cannabinoids hold the potential to revolutionize healthcare for millions of people underserved by conventional medicine. Using psychedelics is very personal. And the most important part of it is starting to care for your endocannabinoid system and your endocannabinoid dome. The endocannabinoid system is a system about cannabis. The endocannabinoid dome includes the endocannabinoid system plus all of the other neurotransmitter signaling systems, and integrating this experience into your daily life. However, the most important thing is doing the work. And when I say the work, it's interpersonal work. It's the integration step that is needed for lasting change. And so what we have to offer as well is we offer free, we're going to talk about this in an upcoming slide. We have a free intake form at Bloom Hemp service tab. We'll address your questions and help you find a better day. And thank you for interest in our work.
Yep.
And then.
So, and anybody who is a nurse who would like a continuing education unit for this hour that you just spent with us, email us at info@holisticcaring.com and we'll invoice you $25 and then send you the evaluation so you can print your certificate. This is your certificate. And you can also take your phone right now, scan that little image, and that QR code will lead you right to the shop where you can purchase it. And then we'll also send you the evaluation.
Yeah.
And our Psychedelics as Medicine program, you can see the outline here, module 1 through 7 with a very robust appendix. There are 8 hours of continuing education units for nurses. It is a self-guided program where you can learn the history, renaissance, legalities, and pathways to healing for each of the most common psychedelic medicines on the planet. And again, just scan that code.
And then our ecosystem at Holistic Caring and the Green Nurse. So we have, Holistic Caring, the Green Nurse, we merged, we've got Bloom Hemp, and we have a platform off of social media that is run by Jasmine Joy, our amazing pharmacist, and she's our virtual assistant that helps us. And in our private network, we have the free Introduction to Cannabis course, free ABCs of CBD, we have a patient portal, free cannabis medical guide, free monthly plant medicine support group that meets every month, the 4th Monday of the month at 4:20 p.m. And it's where we host all of our educational programs, our provider training and mentoring programs as well. And I think that's on the next slide.
Yep. And then the nurse line, I believe, is on another slide too.
But this is the free plant medicine online support group. So if anyone, and this is free, this meets the 4th Monday of the month at 4:20 p.m. If you scan this link, this will bring you right into the network, right into the space. We have a space where we actually put up research studies, we put up best practices, we put up tips and tricks, hugs and nugs. Elisabeth is constantly posting education and research. And so this is for the people that are new to plant medicine, new to cannabis, new to psychedelics, for biopsychosocial spiritual healing. So you can learn how to optimize an experience using lifestyle as medicine. And it's a safe space where we meet monthly in private. It's not recorded. And we have clinicians, we have patients, we have providers, we have people all over the globe that are coming together because that support is critical if you're using these.
Yeah, because it's not yet a plant medicine world. It's an FDA-approved pharmaceutical world. And so for people that are kicking the tires of this, it's very helpful to have a safe place to dialogue.
Yeah.
And when you scan that, you're going to come to the network door. There's a gate. Just enter your name and your email. We'll approve you and get you right in.
You could say, Nurse Sherri sent me.
Yeah.
All right.
Okay. So,
and then we want to give a big thanks to Bloom Hemp for sponsoring
Thanks to Bloom Hemp for sponsoring USDA organic hemp CBD, woman and nurse owned, doctor and nurse formulated, symptom targeted formulas. So I call it effective efficiency to be able to get you to where you need to be quicker without trying so many different things. It's all in one little packet, have you. So free nurse line, free care plans, and right here you scan that, you go right to the services tab, scan that, you go right into the shop, and then affiliate and wholesale opportunities for those who will have a business.
And then, of course, we have our podcasts. We are on YouTube and Red Coral Universe, where all of these shows are hosted. We also have a link in the network for those that don't want to go on there. You can see all of the shows. We've got that right in the network as well. And then your book.
Yep. Finally, just scan that if you'd like a nice one-stop shop book that you can have as a reference and take notes from and go out and do coaching for yourself and others. So thank you, everybody. Stay safe out there, and God bless.
And remember what it's all about. It's all about living your best life and helping others do the same. Thank you for joining us.
We're here to educate and empower patients to make choices that are best for them. We're also here to decrease stigma around what it means to feel good and be high. Hence the H for hope, I for inspiration, G for growth, and H for healing. The Green Nurse is a holistic cannabis nurse that teaches on the endocannabinoid system and the safe utilization of cannabis and other progressive tools to help people reach a better quality of life.
I was cannabis agnostic for many, many years. And the more research I did, the more I discovered that cannabis is this amazing medicine.
I was told that I had a 4-stage pancreatic cancer. The doctor really told me he couldn't do anything else. He gave me her name and she called me and she came to my house. She started to give me cannabis. My oncologist was puzzled because he couldn't find the cancer anymore.
All of the learning that we get comes from the Green Nurses Group, comes from their support, comes from their guidance. I trust everything that she says.
Simply meet people where they're at. The plant doesn't, stress to grow, so we don't stress to share it. We're healing people.
Cannabis has been used as a medicine for tens upon thousands of years. Here's the big message. Cannabis needs to be federally legal. We need to have laws that are the same across all 50 states that allow access to anyone and everyone who wants to utilize this powerful medicine.